Thank you for coming back. Thank you
for
no see joining us.
Hi.
And yes, me love is in the background. If you don't see her here, she's in the background. Would you like to come on camera, me love?
I don't have my face on.
Sorry, let me stop laughing. Okay. So in this video, we're gonna be doing an RT versus LPN. More likely a Q&A, question and answer much. Yeah, basically talking about the two professions and just giving you guys an idea of which is which, and maybe you guys could choose one of them based off of this, or it could help you make a decision of some kind. Hopefully this video helps. So hopefully it's very informative. Yeah.
Who's the RT? Who's the LPN? What exactly does that stand for?
So if you guys didn't know, I'm the RT. And it stands for respiratory therapist, and I guess that makes me the LPN. Yeah. So what does that stand for? What does it stand for? Licensed practical nurse. Ooh, ding ding.
Yeah. So what's the difference between RT and LPN? What exactly do you guys do or not do?
So RT is certified medical profession who specialize in acute and chronic cardiopulmonary disease. And if you were wondering what is cardiopulmonary disease, cardio stands for heart, pulmonary is lung, so the heart and the lungs. So we specialize to treat patients that have heart and lung problems, such as asthma patient, COPD patient, and lung trauma and other diseases such as COVID-19. And we assess patient breathing, we provide treatment plans, and we monitor the patient progress to see if the patient is doing really, really good or really, really bad with their treatment plan. And we do work alongside with doctors and nurses, especially pulmonologists, and we work in many different medical facilities.
What is an LPN? An LPN is basically a nurse that works under the supervision of either a RN or a doctor. So basically we do certain skills such as taking vital signs, changing dressings, inserting Foley catheters or catheters in general, changing G-tubes, administering food and medication through G-tubes, different skills like that. It's really generalized, so we can basically be anywhere. But majority of LPNs, I would say, are probably in nursing homes, assisted living facilities, places like that.
So for some of our subscribers that may or may not be looking into this field, is there any prerequisite that they should know about?
So for me, when I was looking into respiratory, I already had my associate. I was really looking into going for my bachelor. But eventually, I decided to take the RT route. So one of the couple prerequisites that you will need to be qualified to apply to go to respiratory is English 1101, medical terminology for depending on the school. You need anatomy, physiology 1 and 2, microbiology, and you need chemistry and a college level math like algebra or calculus. So depending on the school, you might need intro to respiratory, but the school that I went to, I needed intro to respiratory, which I had to take.
Well, for LPN, my situation was a little bit different because I did do it while I was in high school. So basically, while I was in high school, I think we took TABES and T's first as I think it was like a reading comprehension test. And then after that, we had to take anatomy and physiology, which I believe was required to get in. And then once you finish taking those two things, you're basically in the program. 11th grade year, we started fundamentals of nursing, and you basically just had to maintain a 70% average in the class. And that's it. Boom, LPN.
So let's talk about
Charting.
Let's talk about
charting.
Let's talk about
charting.
Let's talk about
charting.
We
No,
love
seriously.
you, charting.
always. What's with the charting? Like, what to do, what not to do? Is it really that big of a deal?
Okay, so one of the thing as a healthcare provider that's really, really, really important is charting, because for me, like everybody tell me at the hospital, it's really important because it cover your ass.
All of it.
Cover your ass. Just in case if something happened, you document it, and you have a time frame when you did it and what did you do. Because if you go in a patient room and you touch something and then you leave and not document it, and somebody else comes in, it might be a doctor. I get it, it's a doctor, but if something happened, you most likely will take the blame for it because it's your patient. You should know what's going on, or if it's in the right setting, if the patient is being taken care of. So you need to cover your ass, because that's very, very important. Yes, it's tedious. Yes, it's time consuming.
Very.
Yes, it's redundant.
Necessary. So necessary.
But it's very important.
Very necessary. And it's the same thing for nursing. Like she said, you chart to document. You chart to cover your ass. Okay? For example, you have a patient, who's getting an anti-seizure medication. You go to give him the anti-seizure medication. He's like, no, I don't want it. I don't want the medication. Yeah. And he's fine. It's okay. I'd be like, hey, I recommend you take the medication. No, I don't want it. Okay, that's fine. That's cool. That's fine. But you gotta document that. Put patient refuse medication, so that if they're squirming on the floor like an hour or two later, or sorry, I shouldn't say that. Like, I'm so mean. But like if they're having a seizure later, you can be like, well, he refused it. I can't shove it down their throat. The patient has the right to refuse medication. Yeah. But my job even goes a step further, in that we make the patient sign a refusal saying, hey, they refuse to take this anti-seizure medication. And they sign it themselves, so that if they ever try to come back and be like, I never refused it, after they had their seizure, we could just be like, patient refused. Sir, it's right there. You signed it. So
your signature.
You gotta you gotta think about your license. You work hard for that, and you're not gonna let nobody take that from you. And period. I'm not gonna put that
what she said.
The first time you see your patient, that's one of the crucial part, because you're trying to get a feel of your patient, if they're stable, unstable, trying to get an idea what type of patient you're dealing with. In certain hospital, we chart every 3 to 4 hours depending on the hospital to assess if the patient is doing better or doing worse. Should we change treatment plans and such, like things like that.
Yeah, honestly, it's tedious. It is
redundant.
It's really redundant,
time consuming.
Even the patient might be so stable, you still have to like sit there and think about something to write. Just do it. No, you do. Like the patient is healthy. You can't just put that. So
the patient is alert and
oriented
times 3.
Yeah,
like, wow.
So you gotta do something, because it will really save you in the end.
So what's the job outlook like for an RT or LPN?
So as an RT, the job outlook will look really good, because we are rapidly growing in the healthcare field. According to Bureau of Labor Statistics, they reported as in 2012, there were about 120,000 respiratory therapists that were employed So imagine the other years, the following years. So more and more RTs are being hired. So and by 2022, the numbers of respiratory therapy job is expected to increase about 20%. 20%.
Girl, what book you read that in?
Right?
What book you read that in, girl?
So due to the aging baby boomer population and the likelihood of increasing incidence of cardiopulmonary diseases. So you know, if you go in for RT as of today, when you leave, you'll find a job. Comparing for nursing or other healthcare that is known, and people go, like a lot of people go for known fields, because when I went for my program, I would tell people, yeah, I'm going for RT, and they're like, oh, okay, that's cool. Is that nursing? And I'm like,
everything that's not a doctor is nursing. If you're not a doctor, you're a nurse. That's how people think, and I don't know why.
And I'm like, no, baby, it's not nursing.
So are you a nurse?
No, baby, that's not nursing. And then so it's like, okay, cool. So what is it? And I'm like, so I had to like explain to them what I do, what I'm going for, how long is it. So it's just like, it's very tedious, but I enjoy informing people. It's better than to be informed than to be ignorant.
So what is the job outlook like for LPNs? Surprisingly, it's actually pretty good. So according to the Bureau of Labor Statistics, the job outlook for LPNs is actually 16%. Which is actually really good because the national average is 5%. So even though there's a myth going around saying that LPNs, the job outlook isn't good because they're being phased out in the hospitals and all this other stuff, it's a half truth because LPNs are being phased out in the hospitals, but they're still going to be needed in nursing homes, assisted living facilities, home health places. They're always going to be needed. So don't be scared to become an LPN because you hear everybody saying, oh no, they're being phased out. That's not true.
So do you think your job is more exciting than her job or vice versa? Like, I mean, do you guys really like what you do?
I mean, I enjoy what I do, especially like, because it's more of a subjective question. You can't really say
really from your own perspective and how the person is, because different people might consider exciting as different ways.
Because like in respiratory, we do work in hospital setting, but we can work in offices like pulmonary rehab centers or whatever, PFTs, and those places we don't really have that much patient coming in and out. They're not coding all the time, so you have a lot of downtime. You can be on your phone. Like, I'm not saying that's what they do, but you have a little bit free time. And somebody who like be on their phone all the time probably think this is like the best job. But at the same time, if you work in more emergency department, ICU, you probably enjoy that too. So I can't really say that it's the best, like it's exciting. No, it's depend on the person.
Definitely. I could say when I first started working as a nurse, I was working in an assisted living facility. There's not much excitement. I don't think anybody would find that exciting. I know, I could be wrong. Maybe might be that one nurse who's like, oh my gosh, gee golly, this is the best job ever. But it was very boring, very dry, dull, and just boring. But I now work in a drug rehab facility, and it's actually pretty interesting. No, we don't have patients coming in with like, gunshot wounds and bleeding and gushing out blood and stuff like that, but it's still an interesting field. I feel like drug rehab is like really not known about, and like the patients are interesting, the job itself is fun. So yeah, it's up to the person. Like she said, it's really up to what you think excitement is. Like if you're into the gory stuff, then go for something like that. I think that's more like ERRT type stuff. But if you just like, interesting people, stuff like that,
you can still work for respiratory, but in a different setting.
So basically find what you're comfortable with,
what you like.
Pretty much, yeah. Something that's not going to give you too much anxiety, something that you can handle.
So how long is a typical shift that you guys work? Like 2-hour shift, part-time, full-time?
Wow, Mila, that is actually a very good question. Thanks for asking.
You're welcome. I'm still here, guys. Still here.
So, as a respiratory therapist, our typical shift is 12-hour. And depending what time you want to work, like morning shift or night shift. A morning shift is typically from 7 a.m. to 7 p.m. and you have the rest of the day to yourself. Or a night shift, that's 7 p.m. to 7 a.m. and you get the morning to yourself. And so you work 3 days out the week, and if you want to work more and get work 6 days and get the rest of the week to yourself, you can, depending on the hospital and depending on the person. So,
well, for LPNs, depends on where you work, because when I was working in my assisted living facility, I was working 8-hour shifts. So I was working 3 to 11. But now that I'm working in a drug rehab center, it's 12-hour shifts, much like how Marilyn explained it. It's from morning shift 7 a.m. to 7 p.m. and then night shift from 7 p.m. to 7 a.m. And you can also work those days, like 3 days together as full-time, and then get 4 days off for the rest of the week. Or you can schedule it so that you have like maximum time off if you put like all 6 of your days together. It's kind of confusing, but I work night shift, and I don't know for RTs. Maybe you could fill it in, but
What?
for nursing, we have shift differential.
We do.
Yeah, so if you work night shift, you get extra
Extra
money.
pay.
It depends on what company you are, because my company, well, cheap ass, pays $2 for shift differentials. But I know like hospitals, they might
Probably.
pay like $4, right?
Depend how cheap the hospital is.
Yeah.
Also, we have like per diem for us because if you don't want to be full time, because I just told you about full time but part time per diem, you get paid more, but at the same time you get less benefits
And less hours, most likely.
Yeah, depending if they don't need you. If they need you, they can give you some crazy hours.
Same thing for LPNs. Yeah.
So do you guys see yourself doing this long term? Like, oh, I'm gonna be gone next year, 2 months from now.
No.
Do I see myself long term? No. Short term. Yes.
Of course.
Because for me, I want to advance in the healthcare field because I want to get better. I want to improve in life, and I want to like
That part.
And I really hope, like, for me, like comparing to my parents, and my parents wasn't able to finish high school, middle school.
Hey, level up.
So I was able
Level
to
up.
finish high school. Got my associate, so I'm going for my bachelor. Hopefully, go for PA school. So when I have my kids, they have to do 10 times better than I did.
Do I see myself being an LPN for the rest of my lonely life? No. Okay. No.
What happened to
that's
that?
the,
No.
Sorry.
No.
See myself being LPN for the rest of my life, baby. No. And I'm not saying that to say that LPN is a bad profession. It's
we're not
really
saying that.
not. It's not. Like, RT is a good profession. LPN is a good profession. It's just that, like Marilyn was saying, I want more for myself. Okay, I'm trying to get into medical school. I'm trying.
We are getting.
Okay.
to
No.
medical
Yeah,
school.
you're right. I am
are.
gonna get into medical school. That part. So this LPN was kind of, I don't want to use the word stepping stone,
But
I guess it was a stepping stone just for me to get, by, just have a little money so I could get through, undergrad and go to be a doctor. So I'm not trying to,
discourage you.
yeah, discourage you.
It's
I'm not
more
trying to
like-
talk down on LPNs and
No.
be like, yeah, I could never. It's a good profession. Trust me. Like, you can make a good living off of it. Even if you're not an RN, you could make a good living off of LPN. But for me, it's just, I just want to move up. That's all.
Level up.
Level it up.
Hey.
Hey.
Hey. No, that's
I don't
it.
know how to dance.
It was over.
What me love ... wants to know is, I like to eat. I'm expensive. I don't eat McDonald's.
Yes, I do.
I eat expensive meal, okay?
Panera
Panera.
Yeah, expensive bougie meal. Who's buying?
Mm.
Who's
But-
buying?
Who's buying
Like,
food?
So if you guys did not know, now you will know that RT do make better money than LPN, but you can still make good money off of LPN. But yes, we do make more money than LPN.
Okay. Yeah, what she said. So, what's the average that RTs make?
I would say the average, I think for Florida, around $25, from maybe 20 and up, depending on your work experience, level of education, other little components sums up how much you will make. And especially if, as of right now, hospitals are really desperate for RTs, so you can like negotiate and be like, I want
$30.
this. And if they really need you, and you really have like your certification and your things are on point, you probably make $30 or more because they need you.
For LPNs, the average that they make is $22. So that also depends on whether you're a entry level nurse, or whether you're like experienced and stuff. So let's say you've been an LPN, you're just starting off. They're probably gonna start you off at about like 17. But then again, that depends on where you live and your location, because different places, even from county to county, not even just state to state, county to county pays differently. So the county I live in pays way less than the county I work in, which pays more. So like she said, it also depends on experience. So I know some LPNs who are making $29 an hour, who are making that as LPNs. But that's because they have experience and they live in a a certain area and all that. If all the stars align, if all the factors mix, you could make that much as an LPN. But I think you're really looking at like maybe 20 and up as an average, I would say, for an LPN. And unless your job cheats you out and doesn't pay you enough.
Can you guys feel the saltiness to the camera?
I want them to feel the saltiness because
salty. Shade.
Shots definitely fired.
But it do varies from state to state.
Yeah.
Like if you work in New York compared in California, they make way more because but then again you have to remember their living expenses is higher compared to Florida.
So, yeah, but Florida in general, they don't want to pay nobody. They don't want to pay nobody.
So that's basically all I wanted to know. Do you guys have any advice, tips, or like general information for anybody or anything related to help people get started?
I would say LPN is a great profession. You can make a good living off of it. But honestly, if you're an LPN, I would just move up to RN. You could stay an LPN for the rest of your life, but move up to RN. They have more free space, they have more duties, they get paid more, and they make a great living.
Well, if you are interested in the healthcare field and you don't really want to do nursing, you're not really sure, do your research. It's not only LPN, RTs, and nursing. There's other things out there, and also whatever you're passionate about and whatever you want to do in life, just go for it. Because don't overthink it. Don't have plan B's, because
no plan B's around here.
For me, I didn't have a plan B because I know that was one of my main source, because it's do or die, and it make you more accountable for your action. It make you study harder, it make you do better, because you don't have other choice. Either I make it or I make it. There's no going back.
That's true. I like that. So this concludes our video on RT versus LPN. So I hope it was very informative. I hope you learned something. I hope it helped you make a decision of some sort.
I hope you took notes.
Yeah, take notes. We will be quizzing you in the comments. But I hope this really helps somebody. And if it helps one person out there who just wants to know the difference between them or wants to go into the medical field, I hope it helps you.
Don't forget to hit the red button.
It's not red.
And button. It's okay. She don't have her glasses on.
Gosh, can't with this.
Where's your glasses? Show them your glasses. There you go. The red button, you guys.
It's still not red.
Now for the Haitian Creole word of the day. Swing. 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 Hey, swing. 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 Hey, swing. 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 Swing.
Excuse me.
You're not ready for it.
Excuse me.
Yes.
What does that mean?
Oh, swing.
Yeah.
You did not know?
Swing?
Swing mean care.
Oh. My God.
Pas oublier pour prendre soin des amis ou famille. So what does that mean? Don't forget to take care of your family and friends.
Especially during this time.
I want to know who's buying. I know she's buying.
Right? Whoever catches the bottle buys it.
There was no rules.
Yeah.
Whoever didn't catch it buys. Or whoever thought buys.
Right?
Yeah.
How about that? I can't speak Creole. I'm not gonna have YouTube clowning me. I'm sorry. No, I'm not ready for that yet.
She said she's not ready.